So currently, I don't have the total data. But what I know, like for clinic officers, more than 50% have been dismissed actually, have not been retained. I think for nurses, for clinic officers, it's actually 100%. And in pharmacy, only one has been retained. For nurses?
In PGH only, 175, 88 were retained.
So only about 50%. But you know, the most interesting bit, because this is what we have been asking them. So why did you decide I'm retaining this one and I'm dismissing this one? They cannot tell you. They are saying that there were hospital data and we were looking at the people who are there and plus those who had applied before. How can you say that because you want to employ somebody else, you are going to dismiss the one who is in service? So simply, there is no reason as to why the other people were dismissed other than there were political entities who wanted their people employed. And that is why people are being employed using SMSs. You know, those people have no letters. They are just appearing in hospitals. The in charge is being given a list. Hao watu wamekuja, watafutie mahali ya kufanya kazi. There is a system that has been installed. And I think I should thank Madam Governor. It's a very nice system that would make the facility run better because you'll know when the drugs are out of stock, you'll be able to follow a patient through the hospital. But that program also takes weeks for somebody to learn. You have to be taken for like 2 weeks for you to learn. And these people are not able to operate now because they have not been taken through. They are very new, most of them, because they didn't understand what they were coming to. Some of them wanted to leave some private jobs which are paying better. Wameenda. They have refused to take up the jobs. In summary, this is politicization of health for you. Total chaos. So, as we have already said, the labor rights of our members, of our people, has been contravened. So when a right is contravened, the first instance is you ask the person who has contravened to rectify. So we are going to write an appeal to the governor. By the end of the week, that will be here. If then the governor is not going to take steps to ensure that they enjoy their fair labor rights, then what we are going to do is that we are going to court. But even other than the issue of Nakuru, because it's not only Nakuru that is engaging health workers on these oppressive contracts, we are also going to court. We are also going to High Court on interpretation so that we can put the issue of contracts away. You know, sometimes when we are talking about these things, it looks as if we are just playing politics. Probably it's unions trying to be relevant. But let me tell you, if you look at the number of healthcare workers who are specializing before in terms of percentage, and the number specializing now after counties came and started putting people on contracts, that percentage is declining very fast. In many counties, there are no young people on permanent and pensionable. And so there are no young people who are being taken for specialization. The only consultants you have are those mature medics who had specialized before, who are remaining with only 10 to 20 years before they retire. Once they exit, and then the people will be having in service are only contracts, I can assure you, we will not have specialists. And that is when now people are going to realize what is happening. Yeah? Ile wanasema kwa lugha ya mtaa ndio watajua kimewaramba. Right now they may not see because they are blinded by power and politics. And governors want everything to fit into their 5-year term. But health as a department is a service. And the biggest problem we did, by the way, was to politicize health. Because the moment you politicize something that determines your life, and you know politicians, and you know how politics is done. I've not received of patients who have died, but I know for sure, and by the way, it's not a ghost law. It's simply that there are no enough health workers to take care of the needs of the patients who are seeking services at the hospital. And this is the question we were posing to them. When you are doing whatever you are calling reforms, which for me are in doubt, what do you consider first? Do you first consider your interests and your political image? Or do you first consider the service to that Kenyan that you are supposed to render services to? And the reason as to why I'm saying I'm querying the reform, you cannot tell me that I'm dismissing this one because they were employed irregularly. Then the one who is coming in, you are not conducting any interview, there was no advert. How can that also be regular? So you cannot be sorting an irregular with something else that is irregular. So if the county government really means well, let them take these workers back, because they are workers who have given their best years of their youth fighting, and especially during the time of emergency. These are the people who are in these COVID HDUs when we were having COVID-19. And the way we are rewarding them is by telling them, you know, you are employed irregularly, so we are going to dismiss you, and I'll bring somebody from my village, because somebody from my village is better positioned to enjoy the labor rights than yourself.
My name is Rose Master, Secretary Kenya National Union of Nurses, Nakuru branch. Mimi naenda kuongea kwa Kiswahili. Vile mwenzangu amesema, in fact ame-highlight mengi. Ile kitu mmoja ningependa kuambia Madam Susan, our governor, is we are losing skills. Our people are going. Na tukiangalia wakati wa COVID, kila mtu aliambiwa akae kwao. Kila mtu alitipiwa nyumbani. Sasa ukiangalia every day utaona nurses, clinic officers are going. Why? Because we are not recognized nyumbani kwetu. So, ile kitu tunaomba, sio vita, sio nini, tunaomba angalie sana, because mambo ikienda mbaya, hapa Nakuru ndio utaenda. Hii General Hospital PGH ndio utakuja kuonekana. So tukipoteza wale watu wazuri, na ukiona wale wanaenda nje ni wale wazuri. Watu wamesoma, wako na skills, ndio wanaenda. Tunaachwa na nani? We are getting aged. Kama hatuta retain na tufundize hao watoto wetu sahihi, we are going nowhere. Miaka ikienda 10 from now, ukikucha hapa, itakuwa disaster. So ile tunaomba, wacha tuangalie, tufanye kazi vile inafaa, tujaribu unite na maintain wale watu tuko nao na kuwafundisha. Tusipoteze skills, na tuangalie hao watu kama wazazi, because hao watoto they have nowhere to go. Some are going into depression because sasa you find ulikuwa hii ndio tegemeo lako, umeamka one morning umeambiwa nao hauna kazi, enda nyumbani. Yes, we understand contract siko, but the way they are being conducted sio mzuri. Ile wamefanya like harmonization of salaries zenye wanasema fine, hiyo wamejaribu, because some years back in this county we used to have remuneration nyingine mbaya sana. Unakuta uko daktari unafanya PGH, mwingine anafanya Naivasha, lakini kila mtu analipwa vile mtu anakaa anakupea salary yenye anataka. Unakuta mwingine anapata 20,000 nurse mwingine ako Girigiri anapata 15, mwingine. So hakukuwa na uniform, and yet you have the same qualification doing the same work na mnafanya, but kuna venye wame-harmonize. If you are a diploma holder, you are getting 50,000, which is not what we are asking for. You know, 50,000 si pesa mzuri for a qualified staff, for a qualified nurse, a doctor, clinic officer, unapewa flat rate. Bila allowances, bila anything. So what we are advocating for? Kama you qualify the same, you have the same qualification, mulipwe the same, which they have done fine. But what they have given, pia, si mzuri sana, but wamejaribu. But what we are asking for, wakiwachukua, kama ni uniform allowance wapate, kama ni risk allowance wapewe, kama ni medical, everything wapate kama wenzao. It's not in order, mnafanya in the same department, I'm paid uniform allowance, my colleague is not getting uniform allowance, yet we are doing the same work. So we are urging our excellence, Madam Susan, sikiza kilio ya hawa wananchi. It is not too much to ask. Kurudisha hawa watoto, wapewe kasi yao waendelee, pia itakuwa inasaidia in one way or another. Because tukiendelea hivi we are going to lose so many staff, wengine watacommit suicide, wengine wataenda into depression. So what we are urging right now, we understand there is one clinical officer mwenye alikimbia kwa huko juu akataka kuchinyonga because of frustrations. So we are requesting, vile mumeanza na vile ulitupromise, utimize hayo tafadhali. That's what we are requesting for. Watoto warudishwe kazi because they have nowhere to go. Mtu amekomiti maisha yake yote for 5 good years, akona familia, sasa to relocate is becoming a problem for them. So that is our humble request.
My name is Mary Boniface. I'm the National Treasurer, Kenya Union of Clinical Officers. I'll start by saying this. For healthcare systems to function, there are 6 pillars that must all work together for us to see results. And today, 2 of those pillars have been affected severely by what the county government of Nakuru has done. And these 2 pillars are the human resources for health and governance. We cannot talk of citizens being able to access healthcare when the service provider is not there. And those that are there are overworked, burned out, and extremely tired. And then when that happens, the public comes back to us to blame us, the healthcare workers, that we are misdiagnosing them, that we are not giving them the attention they need. But it was not our fault. It is because we are tired. We have been overworked. And our employers, when we decry of shortage and expecting that they should be employing, actually they are disengaging the people that are supposed to be helping us give services to the citizens. So for how long are we going to look at healthcare as just another sector and not as serious as it's supposed to be for this nation to be able to move forward? So for this we say, and we ask the county government of Nakuru to look back and look at the people that they have laid down and get them to work and actually advertise for more, because there has been shortage even when they were working. So it can only get worse now that they have laid down people. We cannot continue to engage healthcare workers as casuals. Today you ask them to come to work and then one day in an evening you send them home via WhatsApp message without any notice. This is someone who has worked for you for 5 years. They have suffered, they have gone through a lot. And then you don't look at all that. You don't even consider proper exit management. You just tell them go home. That is not proper. We do not want that to happen again here and in any other county nation over. And as unions, we are going to stand with our members and ensure that this does not repeat itself anymore.